While Delhi recorded its highest ever daily deaths at 380 and people continue to struggle for hospital beds, now a five-star hotel has been selected as a COVID care center for judges and judicial officers of the Delhi High Court and their family. Hundreds of rooms in central Delhi's Ashoka hotel have been booked for this purpose, and a private hospital will take care of the facility. Let's go across now to Sukirti for more. In Sukirti, firstly, the worrying situation in Delhi. It's a fight for, hospital beds, for oxygen, for medicines as well, and even for cremation space now in Delhi, and more space is being created. But at the same time, you get this news that a five-star hotel, a COVID care facility is being put up for judges there.
Well, yes, absolutely, Gargi. This is the irony of the system that we have in the national capital at this point of time. I'm standing outside the Ashoka Hotel in Chanakyapuri. At least 100 rooms here have been reserved for Delhi High Court judges, judicial officers and their families. This was a judgment passed by the Delhi High Court. The Delhi government had to follow it, and as a result, the Primus Hospital in Chanakyapuri will be running all the COVID services here. That is what the Delhi High Court judges are getting, but what is the common man getting? As of this moment, if you go to the Delhi government's Corona app, and we will be playing that screenshot on our screens as well, on how currently in the national capital there is just one ICU bed with a ventilator, one ICU bed with a ventilator in the national capital of India for the common man. Even ICU beds without ventilators, there are just 11 of them. So 11 ICU beds without ventilators, one ICU bed with a ventilator, 12 ICU beds in total in New Delhi. But for our Delhi High Court judges, there are 100 rooms in a five-star hotel being set up at this moment. The Primus Hospital helping in that entire situation. But for any common man in Delhi, it is a struggle to get medicines. It is a struggle to get a hospital bed. There are people running from pillar to post, remdesivir, tocilizumab, Fabiflu. We can go on with that list. But an individual cannot get it at a regular price. They cannot get it easily. They will have to run to 30 different places. We've met people who've bought a remdesivir that costs 5,400 for a price of 35,000 or for a price of 57,000 from the black market. For hospital beds, they've run around government hospitals, they've run around private hospitals. They are unable to get beds. As of this moment, 12 ICU beds in total, just one ICU bed with a ventilator in the national capital. But those in power, they can get 100 rooms in a five-star hotel. That is how bad and how ironic this entire situation is. We have recorded 380 deaths in the last 24 hours, the highest ever for the city. 20,000 cases, slight dip in the cases, but not sure how much we can rely on these figures as a trend, because there was the Sunday dip in testing. We tested only half of what we test on a usual basis. So for figures will have to be consistent for a few more days before we can say then Delhiites can breathe a sigh of relief. But at this moment, the common man in Delhi likely to continue his struggle.